Thank you. Good evening. Associate Professor Kenneth Mark, Director of Medical Services, MOH. Associate Professor Aaron Ng, Master of the Academy. Dr. Tan Ye Hong, President of the College of Surgeons. It's a great honor for me to deliver the citations of a very distinguished individual among us tonight, who will deliver the College of Surgeons lectures. He received his MBBS degree from the National University of Singapore in 1982 and was admitted as a Fellow of the Royal Colleges of Surgeons, Edinburgh and Glasgow in 1986, and a Fellow of this Academy in 1993. He started his advanced surgical training as an orthopedic trainee initially, but exited training as a high-flying urologist in 1987. 3 years later, he went on a HMDP fellowship to the Mayo Clinic, and he was the first urologist in Singapore to be fellowship certified in a urology subspecialty, that's uro-oncology, in 1982. In his early professional life, he built from scratch, in 1998, the first dedicated one-stop urology center in this country, with outpatients clinics, endoscopic suites, and operating theater all under one roof. He was appointed the first director of a urology center, SGH, in 1998, and went on to become the second head of Department of Urology, SGH, succeeding Professor Foo Keung Tat 3 years later. Under his visionary leadership, the department attracted the best talents and enabled the development of many urological subspecialties in the hospital. Specifically, he spearheaded the development and training in minimally invasive urological surgery in Singapore, and no surprise, he was the first one that performed laparoscopic adrenectomy, nephrectomy, and donor nephrectomy in this country. Also, he led the department in research, holding multiple national-level research grants, and published extensively in uro-oncology. Many also know him as the pioneer in robotic surgery in the Asia-Pacific region. With a HSDP grant from MOH, he led the development of robotic surgery in Asia. He was the first in Asia to perform a robotic-assisted laparoscopic radical prostatectomy 19 years ago using the Da Vinci robot. Besides his passions in urology and prostate cancer, he's also an educator. As chairman of the chapter of urologists, president of Singapore Urological Association, member of the Specialist Accreditations Board Training Committee, he helped develop and formulate the urology curriculum, establish the training program, annual assessment, and assist examinations for urology. In the international arena, he was the founding president of the Asia-Pacific Society of Uro-Oncology, chairman of the Urological Association of Asia Scientific Committee, and the Specialty Society editor for the Journal of Urology. Just over 10 years ago, in 2011, he did something different. He decided to expand his talents elsewhere, besides urology, and started planning and building a brand new 1,000-bed general hospital. He was the pro tem and later the first CEO of Sengkang General Hospital when it opened in 2018. In addition, he is also a pioneer in medical informatics and information technology. He was the chairman of EMR SingHealth back in 1994 when EMR was still a foreign concept to many. And he was the chief medical informatics officer of HGH from 2003 for 5 years. For his many contributions in public service, he was awarded the SingHealth Group CEO Excellence Award for Outstanding Clinicians in 2011, the Public Administrative Medals Silver at the National Day Awards 2015, and the National Outstanding Clinician Award at the National Medical Excellence Award in 2017. And earlier this year, he was inducted into the Hall of Master Academic Clinicians of the Singhealth Duke NUS Medical Center. After such a long citations, you wonder whether such an individual exists. Indeed, he's a rare breed among us in these professions. He's an artist, a philosopher, a mentor and a coach, an innovator, a sportsman, a hospital and human capital builder, and a leader in his professions. And for tonight, he is a 15th lecturer for the College of Surgeons lecture. So, ladies and gentlemen, I present you Professor Christopher Cheng Y-Sam.
Tonight I have many disclosures, and the first one is John actually wrote that first HSDP paper, every word of it, that went to MOH, and I'm very grateful for John. He's certainly one of those talents that the Urology Center attracted, and I'm one of the benefactors. And also grateful to Prof. Saku, Prof. Ganenmark for actually counter-signing the proposal. So we had the first robot in Asia, and the rest was history, and now there are many robotic surgeons here. My second disclosure is that I will only have 10 slides. So this talk will be hopefully short and sweet and cover the essentials only. And we can go back, just like you. I also want to meet up with all the friends and colleagues that we have not met for 3 years. So rest assured, there will be many more disclosures. So good evening, Prof. Kenneth Mark, EMS, Prof. Alan, Master, and then President Dan Ye Hong. Prime Minister is who? I'm talking about Malaysia. So this scene is familiar to all of us here. It's a few months ago, first day of a new rotation. Monday morning, sunny and bright. I was eagerly waiting to greet the new team. But alas, I waited and waited and waited, and nobody showed up. So I had to clean the patient, drape the patient, position, did something that I'm not comfortable with, like check-in. What's this check-in thing? So I fumble, blaming my senior moment, which is a very often disclosure. And then the chappie showed up, huffing and puffing, mumbling something about, IT briefing. So I thought to myself, when things go south, blame IT. That's why I quit the CMIO job. But what really got me was that the chap didn't know anything about the patient, nor the operation, any pitfalls, and any plan B, but had the cheeks of asking, "Hi, Prof, can I scrub and do this case with you?" And of course, I have to say yes, right? The master is here. And so he got between the legs, like most urologists will, our patient. And then I momentarily took my eyes off the monitor screen and looked at the C-arm over there. And lo and behold, the stand that we were supposed to replace slipped out completely and dropped on the floor. We can't pick it up, right? ID, infection control. Much as we tried, both he and I couldn't put it back. So by then I was sweating and trembling, imagining what the conversation with the dear wife of this patient would be afterwards. Happened to be a very senior colleague in another department. "I'm sorry, so sorry, ma'am. I think I have to call IR, interventional radiology, and see whether we can put the stent down from the top through the kidney. If we fail, dear husband may have to live with a permanent laparostomy, which is not a pleasant thing to do." Just when I was in this nightmarish thoughts, my dear head of anesthesia standing there with the arms folded, said in the sweetest voice, Dr. Cheng, are you done yet? I knew instantaneously I was in trouble. It's a bit like when my dear wife Brenda said, Chris Cheng. So maybe all of you, I really wanted to scream right at that moment. We say that it's just a normal day, start off bright and sunny and cheerful, but it can go down south unto what happenings. And what was meant to be a happy learning, team building environment can turn suddenly very tense and hostile even. It could be simple things like, okay, my favorite assistant is not available, maybe migrated to New Zealand already. I was told that in some hospital, 50% of the scrub nurses are new. And what you're used to, everything in order, take a very long time. Maybe instruments don't get assembled very well. Or, touch wood, never happened to you, happens to me a lot. Patients bleeding, and anesthesia is counting the bottles, and things can go quite badly. I'm sure that among us, we would have heard surgeons scream, throw instruments even. And there are many of you among us, Chiu Min Ho, who charm everybody to fall in line. And not a word will be amiss, and things will go, orderly again. But I'm sure that many of you would have experienced this, not just in the theater, but also in the SOC when the workload really goes up and waiting time is very long and people are complaining in the ward rounds, rushing from place to place. And suddenly the environment changes. Even decent people, well composed, very mindful ordinarily, can also turn into passive aggressive, making disparaging remarks and make people feel small and unwanted, essentially spoiling each other's days. So, are there ways to ensure, that people coming to us actually have a consistent, pleasant, not pleasant, but positive experience, enriching learning environment? Other ways to do our training better prepared for this environment? Oops, wrong number. Blame IT. 2008, Singapore Grand Prix. A Ferrari drove off with a gasoline hose still attached. There was a picture of the fireball that beamed across the world into the living room. Luckily, nobody got hurt. The F1 pit lane, in many ways, very similar to the high-stick environment of the OT, also very high tension. People are on edge, and yet very dependent on very close-knit teamwork, coordination, collaboration. F1, how many seconds? 6, 8 seconds, they have to change everything. So sometimes they forget. And so how did the F1 team deal with this? I'm sure that on that day there must be some screaming as well. You can hear nowadays a comm set that are transmitting what the drivers are saying to each other, and some of them are censored, I think. Are there some practices and processes and maybe even training that the F1 team goes through that will prepare maybe our pit stop surgeons, right, better for this stressful environment? So the title of tonight's talk is really coaching for surgeons, but more a coaching of the surgical pit lane, right? A bit like the F1. But before that, let me just thank the college for this unique honor and privilege to talk to you. This is a list of the previous lecturers of the College of Surgeons, from dear Prof. Saku, then DMS, to my mentor, Prof. Fu, Prof. Kenneth Mark. When I read through all the transcripts that are now actually published in Asia's journal with the highest impact factor of 8.7. Congratulations. Well done, team. For the rest of us, please submit more articles and review your journal's submissions quickly as a referee. Don't delay. They uniformly talk about, all the qualities of the ideal surgeon: altruism, ethics, art of balance, selflessness. And I think it's all published there. There's a lot of wisdom. Mostly it is about skills, knowledge, state of the art, matters of the head. But today's focus is about conduct and attitude, more about matters of the heart. In this book by Timothy Galway, a tennis coach, called The Inner Game of Tennis, he said, peak performance equals your full potential minus the distraction. And distraction means what is your private conversation in your head. So Djokovic, the Wimbledon champion this year, was interviewed after he won the last Wimbledon. And he famously was quoted in saying that the opponent across the net was less troublesome than the opponent within. What is the conversation going on? And who am I? So like this iceberg, what is above the surface is only the tip of the iceberg. It's the outer game that you observe Djokovic's aces in service and, ferocious punches. For surgeons, is the state-of-the-art knowledge, the surgical skills, expertise, and experience. But what flows into the behavior, the conduct, and the attitude is within the inner game. It's much harder to fathom, like the big iceberg. Even harder to train or mold. It is about what is the meaning to me, to you, the decision making. Is it for the patients 100%? Or is this also for myself? Are they even self-aware or other person aware or emotional intelligence? And what is the self-identity and inner beliefs? Essentially asking the question, who am I? Who am I as a tennis player? Who am I as a doctor? Who am I as a surgeon? So I went searching and came across this 2012 article by Atul Gawande, the surgeon author. I think he's an endocrine surgeon in Boston. He's also a consultant to MOH, if I'm not mistaken, who visited us. And in that commentary, he asked, top athletes and opera singers have coaches. Should we? He went on to invite his previous mentor, who is in retirement in Florida, back and have him stand at the corner of the theater, observe a total thyroidectomy. And the debrief in the tea room after that shocked him. It has nothing to do with how he performed the surgery, but everything to do with his conduct in the theater. He said, your elbow was in the dear lady resident's face. She was uncomfortable throughout the 4 or 5 hours. Anyway, he couldn't see the surgical site, so she wasn't very helpful in your surgery. You ignore the medical student standing on the other end nearer the foot the whole time, and he had trouble staying awake. Worst of all, when there was a downturn, there was comments about his conduct in adverse situations. So I did just that in the past year or so. Stood in the theater, took some notes, observation, conduct debriefs, and it was actually mutually rewarding. I learned, as well as I think there was some sharing. I went one step further into coaching and did a 96-hour 4-module SMU certification course, and was astonished to discover this new discipline that new to me. It's been going on for about 10, 20 years actually. As a very fertile ground of self-discovery first and foremost. That's why coaching for coaches actually is for you and I first and foremost. It's a self-discovery process, and it is still evolving. I thought potentially the right tool that we could experiment on. So I shamelessly copied these slides from SMU, still hot from the press. I just finished the course, so I just share with whatever little knowledge I have with you and see whether it fits. It took me a very long time to understand my 2 coaches who told me, you can forget about the rest of the slides. This is the one and most important slide. I said, it's such a simple slide with 2 persons staring at a box. What's so special about this? It took me a very long time, and I will share with you. So the coach, this lady, is staring at the coachee. Basically, you are my full attention. Everything is for you. And it's how do you realize your full potential in solving your problems. Whereas the coachee or the student is staring at the box. The box represents the problems that's occupying its head. So a surgical resident might be worried about how to do that difficult operation, how to get skillful, maybe how to pass the exit exam, secure a HMDP, start a family. The number one worry may be securing a consultant job these days, manpower planning. And the coach only stares into the problem box momentarily to understand the context. But all the time is on the coach interpretation of the problem, his mental state, his emotional state. The coachee as a person, full attention. Then I realized through my own coaching experience, now thanks to some of my friends who let me take them as guinea pigs in my coaching learning lessons. You see, I need to clock 100 hours of coaching, you see. And I realized that actually to be a coach, we need to attend the course, actually not so much about getting the certificate. It's about unlearning many of the habits that we have formed as seasoned trainers, teachers, mentors even. And we can't take our eyes off the box because the problems that this fellow presents as his problem to solve are all the journeys that we have walked through before ourselves. So we have so many stories, we have so many insights, and we are eager to share, and so that when the coachee is talking, we are already thinking about what else to say, and therefore we have stopped listening actually. We are no longer focusing on the coachee, we are focusing on what I want to share. And I realized that urge is immense, at least for me. So this is my second disclosure. Yes, I probably have screamed at many people. Yes, I probably have wasted many of the hours that we have interacted, trying to download what I think you should do. But I must share with you another story, which was just last week. So Prof. Fu published a book on the art of balance. So the book launch, the guest of honor was previous minister, Koh Boon Wan. And he said, I'm a Buddhist. I'm completely in line with Prof. Fu, in the art of balance. But, he said, everyone has a different sweet spot in that balance. Your balance may be quite different from the current generations that are coming into the resident. They are different, doesn't mean they have a different sweet spot, doesn't mean they're right or wrong. And your version is the only version that is the correct one. So I thought, wow, that's profound insight. And indeed, we can never really walk in other people's shoes They have different life experiences, they have different programming, they have different aspirations. We can only look at them and say, what can I do for you? And promote reflection. So take home from this is, in fact, from my personal experience, the deeper you are into training, the more you have to unlearn. So when the urge to share ceases, I think the learning begins. So don't worry, I only have a few more slides. I will quit and shut up and let you enjoy the evening. But essentially, it is about the art of enabling the coachee to have their own insight. So being an art, it means it is actually more abstract. It is not articulate. It's not thou shall do 1, 2, 3, 4, 5 and your problem will be solved. So if you look at the second slide, which is the bottom is push, that means you are using the coach resources and experience and storytelling, giving advice, sharing experience, which is what we are used to, introducing techniques, giving feedbacks, thou shall do this, thou shall do that. Versus the coaching approach is more on the pull side, which is you create the opportunity, maybe silence, witnessing, but encouraging, so that when the coachee tells you what the problem is, actually they are thinking, articulating, clarifying their thoughts while talking. So I know that there are some studies in the clinic where the physician routinely cut off the patients like within 15 seconds of their telling the history because we have so little time. It's also repeated in many of the mentoring, and because we have so much urge to want to share. So it turns out that this Fan Biji, so I was born in Hong Kong and brought up in an environment of Fan Biji, but I must admit, another disclosure, I never took care of looking at this word, right? I saw this is called logography, right? It's actually a picture. You can see the ear, the adult. So I said, okay, Ting is listening with the ear, but never asked the question, why is there a Huang there? Huang means king. So there's a lot of wisdom in this word because in deep listening is really full attention, treating the speaker as the Huang. You are so important. I'm not going to touch my handphone while you're talking. I'm not going to look away. Sorry, I'm delaying your dessert, so bear with me for 1 more minute. So I'm very grateful for your silence and full attention. So that's the Huang. Undistracted, undivided attention, ultimate respect. And I never noticed that actually what looks like the 2 eyes with spectacle is actually mu. I think all the ophthalmologists or plastic surgeons will recognize that. But turn 90 degrees, because the mu is supposed to be vertical. But shi mu, there's a 10 on top. Why shi mu? You don't have 10 eyes, We have shi yan, wearing spectacles, but shi mu, it means that you are not just using the ear, you're using all your senses, your eyes, your feel. You're not just listening to understand, you're listening for the emotion behind, you're listening to what's the mental model, what are the song below the words that's expressed. Full attention. Beyond what the ear is hearing. The most important is the last one, right? The yi xin. There's a yi and there's a xin. It means heart listening. It means loving kindness. I'll come to that. It means UPR, unconditional positive regard. It means non-judging. So somebody asks, where's your mindfulness? This word is about mindfulness. So, to summarize, in coaching, you're asking questions rather than giving instructions or advice and suggestions. It's about promoting reflection, self-discovery, so that the coachee, in finding their own options and solutions, will then own the solutions rather than taking the instructions from you half-heartedly. and they will then execute the plan. Whereas in mentoring, you try to teach them as much as you know so that they become like you. Does it work? Advisee, of course, even more. You're asking for specific advice. I'm sure in skills and knowledge domain, there is that dimension. But in character, in conduct, and attitude, it's about the inner game, which to me, I've been searching for what is the best model. Some people say it should be role modeling. So it's a bit radical, but actually we are not alone. So earlier on in the conversation, I was told that they are actually teaching coaching now in Civil Service College, CSC. And the Zoo and Lazada are going organizational coaching for everybody. And recently I talked to Ben Goh and Christopher from NUH. I'm pleased to report that all first-year medical students are now offered coaching. And then they're recruiting the retiree professors to go for courses in coaching. So I asked the innocent question, how effective are they as coaches? Someone said, not everybody is able to pivot. That's just underscoring my point. The deeper you are into training, actually harder it is, more to unlearn before you become an effective coach. I was told that Eugene is also interested in HG and then making some steps. In Singhealth side, Pakichi is in charge of the Joy at Work, welfare workforce. And there's also programs for mindfulness. And if I get my act together, together with my group, we might make also an attempt to make some proposal about Singhealth coaching. So Zoo is doing it. A lot of corporate organizations are doing it, international companies. But I want to share another story, which is this young 30-plus. He was a guest lecturer for my SMU course, just the last module. He's not a permanent staff. And he was a youth counselor for troubled youth for many, many years as a youngster, and probably practicing coaching already in those environments. And then in his own words said, retrospectively certified as a coach. He was hired by Lazada 4 years ago and was able to convince Jack Ma in Alibaba, who is the parent company, that for Lazada to become the Amazon.com of the East, the tech company, with a lot of youngsters with very different aspirations, they may benefit from coaching. So they have an organization-wide coaching, from both internal and external coaches. And what I was most impressed with, so much so that I invited him to come to senior management in Singhealth to use his communication skills to explain what coaching is all about. He said, when I put on my coaching hat, I never take off the hat. It's 24/7, it becomes a way of life. Because my coaching mindset is based on UPR, unconditional positive regard. Whether my troubled youths that need help are gangsters or maybe some infringement with the police, have a criminal record, irregardless. Even for myself, this is 24/7 coaching mindset. I said, what a nice metaphor. I don't ever take off my hat. Every experience in the corridor, in the ward, in the clinic, how nice would it be if both parties, after meeting each other, part ways feeling enriched, charged, feeling treasured, feeling loved. So that's UPR. I thought it's the core of the coaching mindset. And of course, coaching is much more than just deep listening, empathic listening, and UPR. Therefore, I'm somewhere between ACC and PCC. MCC apparently refers to Master Certified Coach, meaning they can coach the coaches. I guess it's a little bit like MMed for academy. It's, some four-letter word. But you get what I mean. It is really not about just the words. It's about the practice. And it's not just about the practice when you're coaching. It is about a way of life, even when people are not watching, even when nobody is watching. Who are you? So this evening, I started comparing the F1 pit stop with the OT. But of course, surgery is not just OT, and people are not F1 cars. But I'm quite sure the F1 team have coaches, because, it's a sport. Is it time that surgeons also have coaches? I'm very happy that with the structured training that we have today, I can honestly say that the present cohort or the previous cohort of residents really have equal, second to none, state-of-the-art knowledge. And the skill sets perhaps honed at many simulation opportunities, practices, structured training, actually very sound. But I hope you agree with me that beyond knowledge and skills, the conduct is just as important, if not more important, in today's very complex and often turbulent. I think DMS earlier talked about some of the legislation that has passed. I mean, those are addressing some of the issues that we are facing increasingly. So I hope you agree with me that perhaps we should also explore the transition, just like we went from apprenticeship training to structured training. Perhaps it's also time to think about how to transit from, I would call it, opportunistic role modeling. It's not a structured role modeling, right? You can role model both good and bad behavior. And perhaps explore coaching as one of the options to perhaps give us a better standing, better handle on the conduct and attitudes. And I think that the UPR being the core of coaching, at the heart of coaching, is really asking the most important question about who we are, who am I? Do we have UPR? Do we have loving kindness for ourselves, for our patients, for our colleagues, 24/7 as a way of life? Because I firmly believe that one can only be as good a surgeon as you are a good human being. One can only be as good a doctor as you are a person. And I think to a certain extent, this world of coaching may help us answer that question. Thank you very much for your attention and enjoy your evening.